Go live with Dr. Carolyn Best, who is doing this for the third time. She is an obstetrician, urogynecologist, and an amazing mama of two. And she's also been working shifts at the hospital all week delivering babies. So we are going to be hearing from her very soon. She's going to join us. And I have a ton of questions you guys asked. So if one of the questions that we're talking about here isn't, you're missing, you want to know something that we're not talking about, feel free to just use the comments below, and if we can, we will answer them, or I should say Dr. Best will answer them, if it's something that sort of, needs to be discussed. Let's do this. Let's do this. Crazy times we're living in, that's for sure. Hello, Doc.
Hello.
How are you, my friend?
I'm good. I'm just trying to adjust the camera here because it's a different setup this time. So
yeah, totally. Me too. I'm in a different spot too. Awesome.
I'm well, thank you for asking. I'm physically well.
Man. Good. Physically well. Mentally, how are you doing?
These are the answer to that question is something that we're going to talk about more, of course, because I think a lot of the questions that people have and that I was reading that you had sent me have to do with our fears and anxieties about the situation. And I would say that for me, the last two calls that I've done, I was on a staycation. It was March break, and I hadn't yet returned to work. So I didn't know what that was going to be like. But now, having done a few shifts and worked a few times under these current circumstances, I can say that it's up and down. There are times where I feel very strong and positive and confident about it with the help of my colleagues. There are times where I feel the opposite, but, especially with dealing with things at home, which I think many of us are, dealing with different degrees of things at home and how this has impacted us. But I guess I want to say to start off that I think we all need to acknowledge that all of us, regardless of whether we're a healthcare worker or not, this is impacting all of us. And so I think that we need to give ourselves permission to feel whatever we're feeling and know that we're not alone, that not every single one of us is being affected by this. And it's okay to feel those things and also not to judge others based on what they're feeling. So I think that'll probably come up in our discussion tonight. Different feelings about birth and circumstances. As long as you're not physically or emotionally, psychologically harming others, it's okay to feel what you're feeling. And we also have to be understanding of each other because we're all going through this. Totally. So I'm up and down is the short of it. I'm up and down.
Well, first of all, thank you. So you delivered some babies this week.
Yeah. Since last time I spoke to you, which was not this past Thursday, but the Thursday before, I went into work earlier than expected just because I was covering some of my colleagues that were quarantined for their travel. So everybody, again, that had traveled is required also now by law to isolate for 14 days. So that affected our group. And so I went in to cover for some of my colleagues. So I did some shifts on labor and delivery last weekend. And then this past Friday, again, I worked for 24 hours the day after we were supposed to talk the last time when I just wasn't ready. We have had a lot, including tonight. I actually just left a Zoom call that we had tonight at 7:00. Constantly having meetings about the best way to handle these things. So that's the information I bring with me to help answer questions.
Well, we're getting it pretty fresh off from the source. If you just literally hung up from the hospital meeting and now you're joining us live. So thank you for that. We got a lot of questions and I sent them to you so you kind of know what we're going to talk about today. But I think the big thing that's on a lot of people's minds, and it's on my mind too, obviously. I mean, I'm 6 weeks away now, 34 weeks pregnant, so this is imminent. is just the changing policies about birth support. And there's a lot of questions going on. There's a lot of anxiety about it. A lot of people are saying, oh my God, is my partner going to be allowed? Is my doula going to be allowed in the room? Should I move to a home birth? You know, and there's even a campaign, I believe in the US, saying I deserve birth support, hashtag I deserve birth support. So it feels like a very big topic. And I would love your thoughts on the whole thing.
You want me to go with this?
Just talk, please.
Just go. So I'm gonna start by saying that anything I say or give advice about is not going to be specific to any one person. That I can only speak about general principles, and everybody should speak to their own healthcare provider about their own circumstances on what is the safest option for them. At the very moment, to cut a long story short, I will say that so far in our unit, we have not had, to our knowledge, any women laboring or delivering who have been positive for COVID-19. So that is not expected to stay that way, but all these calls and meetings that we've been having have been about this step by step, and I'm talking painstakingly, cautious step-by-step protocols and how to handle every possible scenario that can come up in labor and birth, whether it be vaginal or C-section, in terms of the safest way to handle it for each patient that we could come up with, but also our staff and our healthcare providers and our team, which is just as important in terms of protecting our healthcare workers, because without them, even though I'm one of them, I can say we're going to be in trouble if we start dropping like flies. So I don't mean to get philosophical, but I'm the only medical professional in my family. So my husband, my parents, my in-laws nobody else is medical. So I've been able to get some perspective on how this scenario is affecting everybody. And I also speak from the perspective that I'm a mother as well. And somebody there is asking now, do I work in Canada? Yes, I work at the Oakville Hospital in the Halton region in Ontario, Canada. So it may not be applicable to all regions and jurisdictions, especially if we're talking about the United States. The degree to which the policies are created depends on the prevalence of the reported disease within each community, the degree of community spread, and the amount of patients being actively treated for COVID-19 within each hospital jurisdiction, okay? But what I was going to say is that the issue that I think is at the core for everybody, whether you're medical or not, because I've had to talk to all my family members about this as well, is that it's almost cliche. These are unprecedented times. None of us, I'm not going to say how old I am, but none of us in our lifetime have experienced anything like this. This is like, in the last 100 years. And we are used to a certain type of life and a lifestyle that involves traveling wherever we want, whenever we want, budget permitting, seeing our family members and our friends whenever we want. We're used to certain standards in healthcare. People love to have birth plans, which I'm very supportive of. As an obstetrician, our plan with whatever happens for your birth is for you to have a safe birth for you and your baby. So these are things that we're accustomed to, going to the store whenever we want, going places whenever we want. This is all, I don't mean to sound alarmist or dramatic. You have to consider that at this time, it's out the window. So nobody likes it. Nobody wants to do this. And we're all experiencing different feelings about that. I would say the people that are having the easiest time with this scenario are the ones that are able to let go of those conveniences of modern life the best, and realize that we don't have control over this. We don't know how it's going to happen. We don't know how long it's going to go on for. And I'm not trying to sound scary about that. I'm just saying that as healthcare providers, we do not want to deny anybody the things that we're used to having during the process of birth or any kind of healthcare. But the circumstances for everybody's safety have forced us to change the rules and to have suggestions that are against what people want. So nobody wants to deny you having visitors in labor. In the unit I work in, used to call it family-centered care, where we would allow as many people as you wanted in the room. So I've done deliveries with 6 or 7 aunts and uncles and everybody's kids in the room. Okay, that wouldn't be my choice, but the point is, that's fine. That's what we have been accustomed to doing. And, you know, everybody, and I know you and I have spoken, people have doulas, which are awesome. Doulas are by nature right in there with you, with their hands on your back, all kinds of stuff to support you during labor. These circumstances simply are no longer safe for those kind of practices. So the virus, just to review and explain why, I mean, in my hospital, we are still allowing 1 support person. So that is, so I should adjust myself here on my yoga mat here in the attic. But
why are you in the attic, Dr. Best?
I'm living in the attic by myself.
She's self-isolating away from her entire family.
Yeah, I am. We'll go back to that. But we are allowing still 1 support person, but it's the partner. We're not allowing doulas in the unit right now. Other hospitals, like I said, it depends on the region and what they're dealing with, are not allowing for any visitors. Our hospital generally is not allowing for any visitors, with the exception of the birthing suite, the partner, and pediatrics, meaning kids can have a parent with them, or if somebody is dying. Other than that, there are no visitors in the hospital for this reason of infection control. So this virus is predominantly spread, as I've mentioned, if anyone's listened to my previous, conversations, by droplets. So droplets of moisture from the nose or the mouth or the respiratory tract, which are connected, of course, that are spread when someone coughs or sneezes. That is what the principle of personal or social distancing, they're calling it personal distancing now, not just social distancing, but personal distancing of at least 6 feet apart. That is because that's how far a droplet can spray and land on a surface. And so that has active viral particles in it. If somebody else touches it and then touches their own face, then they're infecting themselves, potentially. So that's where that principle comes from. What we have concern about now is that, first of all, this is an infection that is spread and is involved in the community. It didn't originate from the hospital, okay? It comes into the hospital because other people are going through the hospital. It comes into the hospital because other people are sick, but who have the virus, but it's in the community. So the hospital isn't by definition a dangerous place otherwise, okay? But that's how it's spread. So the reason why we're restricting visitors is because we think now that a significant number, or potentially a good proportion, of the community spread that's going on now, that hopefully people are not traveling and gathering as they shouldn't be, a good amount of the transmission between people is occurring through what we call asymptomatic or carriers, or people who have the infection but are not actively demonstrating symptoms. They don't yet have a fever, which 98% of people will get. They don't yet have a cough, which at least 70 to 80% of people get. So the problem is there is a period of time, it's called the incubation period, from when you're infected to when you actually show symptoms, when you may potentially spread the virus unknowingly. So that means that you can touch you ask not to touch your face. Part of the reason is that because anybody who may have it, not know it, will touch their face, touch other surfaces, and same as droplets can spread, the active are left on surfaces somebody touched their face. So personal distancing, don't touch your face. Washing your hands eliminates it from your hands. The reason why people are restricting visitors is because every single person who comes into the hospital or who is within that physical distance can potentially be a carrier of the virus. And, when we're screening people when we come into the hospital, we say, do you have a fever? Do you have a cough? Have you been around somebody who's a known positive? Have you traveled? These things. But we are recognizing that there's still going to be people that say no, 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 and no to all those questions, but may still be a risk. So there's some communities where they're having a real problem with this to the degree which they're saying no visitors in the birthing suite. Now, nobody thinks that anybody should give birth without their partner present. Nobody wants that. But that's what I was saying before. These are times and circumstances that we have not experienced before. And our degree of discomfort with it has to do with the fact that it is against the usual, I don't want to say luxuries, but privileges that we're used to having. I personally have given birth twice. My husband was there. Of course, I don't want to think about anybody delivering without anybody there. But first of all, we're not, and I know I don't mean, I'm not trying to be sarcastic, but we're not going to put you in the room and say, here, give birth. Like, we have excellent nurses who are a one-on-one. It's not like you're going to be alone. And that does not make up for the lack of a partner or a doula, whoever you choose. But that's the point, is that anybody that enters is a risk, not just to the other healthcare workers or even to the baby, but to other women and vice versa. So in our unit, we have somewhere between 8 and 10 births in a 24-hour period. Some units have more, some units have less. But if you consider 10 as just like a basic number, 10 women giving birth, and now we're still allowing partners in our unit, but if you considered the reasoning behind saying no visitors, no partners even, under extreme circumstances, which many places have had to deal with, whether it's in the United States, in New York, you know, that's, if everybody had a partner, that's 10 more people every day that are entering. And, you know, your asymptomatic partner is just as much of a risk to you and everybody else as the next woman's. So the point is that whether we're talking about the birthing suite or everybody, like just staying home in general, we're all under unfortunate circumstances, but we're all doing this for each other, because it only will work if all of us participate. And it's super unfortunate that it can affect birth in this way, but that's the reasoning. That's the reason why people are saying that. Because, and I talked in some of my previous interviews with you about the vulnerable population. The majority of the deaths are unfortunately in elderly, in people with other medical diseases, but not all of them. There are some younger, healthy people that are also passing away from complications from coronavirus. And the majority of the infected people, so although more deaths are in the older population, the segment of the population that is the highest rate of being infected are actually adults between sort of 35 and 50. So younger people, okay, that are actually carrying it with varying degrees of illness. Maybe they'll become very ill. Maybe they will unfortunately die from it, or maybe they won't show any symptoms. And that's the problem, is that we just can't take that risk sometimes. Does that answer the question?
I think so. I mean, you're saying that obviously, you know, some people are asking, will my partner be allowed? And I think the answer to that, and you and I spoke about this privately, because I've been texting you, asking you, is it depends. Because currently at your hospital, the partner, usually the dad, is allowed in.
And if there isn't a partner, for a woman who is single, I've had mothers or like a family member that they've designated, right? Yeah. But yeah. One support person.
Yeah, and one support, but no doulas. So, and you've explained, thank you for being so clear and candid about that. You've explained why that is, and that you've also explained why at some hospitals, as crazy as it sounds, this is unprecedented, of course, and it sounds like you guys have had tons of meetings about this, and you continue to, you know, making these decisions. If this is a community, say, maybe in New York City, for instance, where, you know, it's a huge, like the hospitals are overrun, there's a ton of community spread, that they're not allowing any birth partners inside the hospital. So women are saying, well, I don't want to birth alone, but, you know, it's also to prevent the spread to the vulnerable newborns and other mothers who might be birthing, and the healthcare workers. So yeah, some people would then say, and I've asked you this question, should I then just have a home birth if I'm
Right.
a candidate?
I'll
Yeah.
address that. Somebody is asking in the questions, are we pushing for cesarean section over vaginal birth? And so I mentioned this before, but I'll say it again, is at this moment, no. We don't know the answer to that, to be totally honest with you. In China, they performed a lot of cesarean sections just simply because of coronavirus status, which makes it hard for us to extrapolate or use that data or apply it to ourselves. But, you know, I'm an obstetrician. Sometimes our public impression is that of a group that want things to be as medical and interventional as possible. That is not the case. We want you to have a vaginal birth, no epidural, no IV, if that's what you want, if it's safe, 100%. But so at this time, we're still supporting vaginal birth with the fact that vertical transmission, meaning infection of the baby before delivery, during delivery, has not yet been clearly documented as a risk. There have been anecdotal reports since we talked the first time that maybe this is happening, but not enough to say for sure. And in every circumstance, we're wondering if there's other circumstances that allow the baby to get infected after birth, which doesn't count. So the report is no, we're not advocating for C-section. We're doing C-sections for the usual indications, whether it be maternal, meaning them for the mother, or any complications during labor or for the baby. So home birth. So I don't perform home births. In our jurisdiction, in our region, and in the province and in Canada, registered midwives will perform home births. I will say, first of all, that the hospital is not an unsafe place right now to give birth. It is not. So please, 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 please don't have an unattended home birth. And I know that sounds like, what? But people have asked me that. It's not safer. So midwives are registered, trained. Hi to my midwives watching. Birth practitioners, we have an excellent group that work with us. We work together. They're the ones that provide care, standard care for home birth. To have a home birth, you need to fulfill criteria. And the reason why we say that is because in obstetrics, meaning during labor and birth, things can happen very quickly. And again, not trying to sound alarming. The vast majority of the time it's totally fine. But things can change very quickly. So people with risk factors or certain histories, there are certain times where you're not advised to have a home birth just simply because of the fast availability of emergency care, including cesarean section, for you and your baby safety. So ask your midwife is what I'm saying, whether you qualify for a home birth and whether it's justified in this circumstance. People will want to have a home birth at this time for a couple of different reasons. The first one I mentioned is again to do with cleanliness and infection risk of entering the hospital. I would say the hospital is trained and the staff are all trained how to take precautions universally under these circumstances when it comes to cleanliness. And we are now moving towards all wearing protective wear for all deliveries. So we're wearing gowns, gloves, mask with a shield for every delivery. Because of the issue around asymptomatic, like I mentioned, spread, but also because bodily fluids are everywhere, let's be honest. So that's just an infection risk anyway, without coronavirus. So we're doing that. And midwives are doing that as well in the hospital. So a home birth is not meant to be an alternative to avoiding the infection. I understand that the hospital is a huge building and lots of people are in and out of it. The potential for more traffic of people that are potentially infected, totally a fair consideration. It's still not going to be a safer option if you shouldn't be having a home birth anyway to stay at home. The other thing, the reason why people are considering home births is, so wait a minute. So for that first point, remember that midwives are also healthcare practitioners that work in the hospital as well. So if you're worried about healthcare workers being infectious, they are as well. We all know how to take the right precautions, and I'll explain more about protective wear and the importance of that, that we are all trained to do properly in a minute. But they are also working in the hospital. Also a home birth, they are going in and out of people's homes, right? So it's not like they're totally, without infection risk. They're going to other people's houses. Okay. Now they're wearing protective wear, but that is not less infectious, potentially, in my opinion, than having a birth in the hospital with your midwife.
Yeah.
And also, people are asking about home births to allow for more attendance at their birth in terms of their doulas.
That was like my big question. My big question. Yeah.
Hi to my doulas out there, because I know some of those too.
And
there's some awesome ones. There's some awesome ones, but you know, it's impossible right now. Impossible. Like, partners are one thing, family members are one thing. I got 2 kids. I live in the attic. I still hug my kids. For now, we don't kiss each other's faces. We wash our hands like constantly. I'm gonna cough, but it's because I'm talking too much. Not a good time to talk. Not a good time to cough.
No, everyone's like, "Oh my God, she's coughing!"
And I realized in the previous video, someone was touching my face. I'm like, just don't touch your face. That isn't necessarily going to be fulfilled by the home birth either, because, you know, I was speaking to one of our excellent midwives, and I'm not going to name her, but you must speak to your midwives about their policies. Some midwives are seeing an increase in desire for home birth under these circumstances. They are happy to fulfill that if safety allows and if the patient meets the criteria, like I mentioned. But it doesn't make a midwife any less concerned about infection risk. And they're requesting careful screening, the same way we are in the hospital, and requesting that the only people present at the birth are the people that live in that house. A doula, it's impossible, in my opinion, unless they're just talking to you, you know, for a doula to meet the personal distancing, you know, requirement of not getting into your space, right? And again, this is just not what we're accustomed to. We're accustomed to a doula being right in our space. So these are just unprecedented times. So a home birth may not allow for you to have your doula or more people there to fulfill that policy that the hospital is mandating in terms of not having doulas for some places. Yep. Huh?
You just have to ask, because it sounds
you
like
have to ask and speak to your midwife. Make sure you're a candidate. Ask what their requirements are and what their rules are, and they're going to have some of the same screening questions as the hospital, and consider whether a home birth is a safer option for you. It'll also have an impact on how far away you are from the hospital. Sometimes what I'm concerned about as an obstetrician, I'm just being honest. This is like honest space here. I'm the lady at the hospital that waits for home birth complications to come in by ambulance. I can tell you that there is nothing, that emergencies right now are only slower because of us having to put on protective gear and manage the infectious risk of each individual. So that is also a concern that I have personally in terms of an increase in home births. That does not mean there's going to be less obstetrical complications as far as I'm concerned, but it affects our speed with which that we can respond to them. Mm-hmm. And so that concerns me. That's my perspective.
Thank you for sharing that. I mean, obviously you've done this now for quite some time, so you are very familiar with the usual protocol, and now you're becoming familiar with, you know, changed protocols and changed capacity, really. And so I really appreciate you being so candid. Thank you. And I know you support home birth when it's appropriate and safe to do so. So for anyone who's questioning that, Dr. Best does support it, and I am seriously contemplating it. So we'll see. I'll keep you guys all posted. I think one of the questions both here as well as that came beforehand was, should I be worried that hospitals will run out of masks or equipment or space or beds? And I think, you know, it sounds like not at this stage in the Oakville Hospital or the Toronto hospitals, but, you know, we hear stuff on the news about, again, I'm going to bring up New York City, for example, New Orleans, these places that are just overrun. So, you know, I mean, obviously you're hypothesizing because you don't know exactly, but do you think that that's a possibility, that some of the emergency COVID cases are going to start to take up space in maternity wards?
I don't think that emergency COVID cases are going to take up space in the maternity ward. I think that would be extreme circumstances, and I'm not saying that we're not going to reach that, but the hospital, although I'm not privy to all the details, has made a very detailed plan about how to increase capacity for people who are sick with coronavirus, and that does not involve the maternity ward. We have our own population to deal with.
That answers my question.
Yeah, I wouldn't work with the beds, but to come back to the masks thing, which I really need to talk about, I would say it is very real that we are facing a mask shortage in the GTA and at our hospital. And I would announce to anybody who owns or has any N95 masks to please, please, please DM me, message me, or, you know, your local hospital and donate those masks. That is a real problem. There is a worldwide shortage of, they're called N95 respirator masks, which protect a person from particles as small as a virus particle that may be airborne. So I need to talk about this more because this pertains to some of the things that people need to know about protective wear. So this virus is spread by droplets, mostly. There has been question in social media and on the internet about it being airborne as well, which means it's just like free floating in the air. It's not impossible, but we know from tracing contacts, and they did this in China and other places, that for sure droplets, for sure. And that makes total sense because influenza, chickenpox, lots of other viral or, illnesses and bacterial illnesses are spread between individuals through droplets, like I mentioned, how that works before. So that's very feasible. You do not need an N95, which is what it's called, respirator to protect yourself from droplets. All you need to protect yourself from droplets is, at minimum, personal distancing, washing your hands, not touching your face. Then on top of that, in terms of what we're wearing all the time, potentially, is a plane called a level 3, basically like a surgical mask, which goes over your mouth and nose and can protect from droplets. But what everybody in the public needs to know, and I mean public in the most, respectful way possible, just simply in that we are given special training in the hospital, is that there is a way to put on a mask and take it off to minimize contaminating yourself. And we're all trained with this on how to put on personal equipment. It's called donning, putting on personal protective equipment, and doffing, meaning taking it off. And it's something you have to practice because it is possible to contaminate yourself if you don't know what you're doing and taking it on and off. So the reason I'm bringing this up is because you'll go to the grocery store and you might see people wearing masks or wearing gloves. Not appropriate, okay? I get it. Totally get it. Wearing a mask totally makes sense. Sure, wear a level 3 surgical mask. But the problem with masks, if you don't know what you're doing or aren't being careful, and this is just simply a tip to everybody out there who's doing this, is don't touch your face with the mask on. As soon as you touch your face, you're now contaminating your hands, right? And there's studies have shown, like if, for example, they're not recommending you put masks on your kids because it has been shown that kids will touch their face more and like shuffle and fix it and fiddle with it if you put a mask on. And adults do it too. I've watched them. So you don't need anything more than a droplet mask maximum if you are insisting on wearing a mask out in public or to protect yourself from droplets. N95 respirator masks, which are the level 4 maximum protection for respirating, breathing on your face mask, have to be fitted to each person. So it is possible you're wearing an N95 and it's not an adequate fit, and it's therefore not doing anything for you. We all wear, and I texted you by accident the picture of my ID card.
Yes.
We're fitted every year, and I have on the back of my ID card the name of the mask that fits for me. There's like 10 different kinds and shapes and sizes. So you have to know which mask fits you to protect you from airborne particles.
How do you find that out?
Well, you're not going to if you're not a healthcare professional, because it requires special testing with aerosolized substances. So it takes like a bit of time. But the point is, you don't need one in the public. You need a droplet precaution mask at maximum. Don't touch it. And N95 for protecting you from aerosolized particles is only required for what we call aerosol generating medical procedures. So that involves intubating somebody, meaning putting an airway tube down if they need to be on a respirator or have a surgery, and other kinds of medical procedures that medical professionals do that can create aerosolization of respiratory droplets. That isn't something that all of us need outside of a hospital. Mm-hmm. So you can understand, we see patients and people walking around with N95 masks on that they purchased. Please, please, people, please donate those to the hospitals. We need them because we're doing these things and there's a shortage and there's a potential for us to be exposed doing these procedures, not wearing those masks. Those aren't required in the public. And they may not even be the right fit. They may be doing nothing for you. Wear a droplet mask only if you insist on wearing that. The other thing is that I've seen people wear gloves, wearing gloves out in public. That is also useless because, sorry.
I legit wore gloves the other day. I went to pick some stuff up at Shoppers and I was like, I better wear gloves.
First of all, when we wear gloves for a medical procedure, I use them for one person to touch just them. I don't touch the surfaces, and then I throw them out in the room and leave. The problem is when you wear gloves, you carry the germs with this, then you carry them to this thing you touch, and then you carry them to this thing you touch. So those gloves are transmitting germs to the next thing you're touching, unless you take them off. And not only that, oh, I think you've lost me.
I can still hear you. You just look like you're purple right now.
I know, I love it. No. I don't know.
Just keep talking, because maybe you'll.
But the point is that also gloves are not able to be washed and reused.
No.
Hands are much better. Are much better in terms of their response to being cleared of germs from washing. Mm-hmm. So you can't reuse gloves, and you shouldn't be wearing them outside of one physical space touching one item. Does that make sense?
So the question is, because it sounds like, and I'm hoping that this purple screen goes away, but at least we can still hear you, so that's good. I want to see your beautiful face. But basically, apparently someone went on City TV, which is like a breakfast television, which for those of you who don't know, it's like a local Toronto morning show, talking about how pregnant women should wear masks and gloves out in the public. And you're saying don't wear either?
I'm saying that makes no infection control sense whatsoever.
Okay.
Okay. Wash your hands. Wash your hands. Physical distance. If you insist on wearing a mask, a level 3 surgical mask, you do not need an N95 respirator. Gloves are not a protection. They're protecting you. They're spreading the germs for everybody else.
Okay. Good to know, because that had. I think that there's a lot of obviously misinformation out there. So I'm going to do my best to screen record this, and then share it. We did that.
I can't believe I'm going against what was said on City TV. That's crazy. But no, I mean, these are basic principles of infection control that we're using in the hospital as well. So you'll see, you'll observe, we take masks off in the room. There is absolutely no way I will leave one patient's room with gloves on. It's just not done.
Yeah. Okay. Yeah. There's a nurse saying here that we need to repost the section where you're educating on it, because the public needs to know. So you guys are all on the same page. So
thank you.
Yeah. I think that, there's a couple quick questions I have that people have asked about, after birth with being pregnant. So someone's saying, I'm 33 weeks pregnant. Should I ask someone to go to the grocery store for me?
Yeah, if you can, I would. I'm not going to the grocery store whatsoever. Okay. I have other people go to the grocery store for me. I have groceries being delivered to my house. I would say, if you have concerns personally about your own risk of infection and somebody else is willing to go for you, I would say absolutely. I think if you have to go, don't panic about it. Don't wear gloves. Someone else asked, then why does my OB make me wear a mask at the appointment? That is fair, because you're in the appointment. You are in an environment where multiple patients are going in and out, and you're wearing it to help prevent the potential for droplet spread if you're an asymptomatic carrier. But that mask is going to be a level 3 surgical mask. It is not going to be an N95 respirator. And now we are also wearing that all the time. And tomorrow in the office, I'm going to be wearing the basic, droplet precaution level 3 surgical mask as a barrier as well, in the office as well. because that's all we really need for this, and I'm not going to be touching my face. So the tip I would only say to you otherwise is then just don't touch your mask if you can help it. And it's hard, like when something's on your face, it's itchy and weird, and you know, that's the concern. And that's the concern with why people are saying that masks don't necessarily change things for kids, is because it's impossible to stop a child from touching their face with a mask on there.
Yeah, no, absolutely. People are asking, should I self-quarantine with a newborn? You know, can my parents come visit if they wear a mask and meet the newborn?
All we can really say about recommendations for the newborn is that don't let anyone handle the baby without washing your hands. Don't kiss the baby's face or hands. I would say this is just still not a time to have visitors, period, I would say, especially patients of the older population. You know, there are, I'm not going to make myself popular for saying that, but I would say no. I would say you got to FaceTime until this is improved. That sounds rough, but to your own choice. If you and your family are comfortable with visiting with masks after 14 days, then you can do that. But you know, I wouldn't.
So you would suggest waiting 14 days before allowing any visitors, and if they do come, you know, and if you know, you
yeah,
maybe then if they do come, they should wear masks.
Well, that's going to be safer. But, you know, the reason why 14 days comes up is because of the incubation period of the virus. So the reason why it's 14 days is actually just to make it easy. The vast majority of people will develop symptoms in 6 days. 5.6 days is the mean sort of time to develop the symptoms from infection. So it's just that a small majority of people won't get any symptoms until like 12, 13, 14 days. So that number is picked to keep it simple, but most people will get sick before that. But that's where the 14 days comes from. If you don't have symptoms, you or your baby or your partner in 14 days after leaving your house and being exposed to other people, then you can be fairly certain that nobody has it. But again, you can't be certain with this asymptomatic thing. But the point is, if you don't have symptoms, the chances are you're infecting somebody else are low.
Okay. I think the last question that we wrote down here was regarding any update on how newborns are doing, and these are specifically newborns who tested positive for COVID-19.
Sure. Now, Nikki, do you think I'm still purple stripes for myself? Am I still purple stripes?
Yeah, you are. It's actually kind of pretty.
Oh, I can't see anything. So should I disconnect?
Maybe we should wrap up with this question.
Okay. I don't have a lot to say about the newborn thing. I did say before that there were no deaths reported under 10 years old. I want to emphasize that everybody is at risk of getting this infection, regardless of age. It depends on your past history and your medical history, but we are seeing young, healthy people, unfortunately, passing away from this disease, especially in the United States right now. It's going to happen statistically with the number of infections climbing. I do not have significant numbers of newborn complications to report. There is a new report of an infant dying from coronavirus. That was from the United States, but it has not yet been reported as to whether there were any other medical illnesses associated with that infant. So that's just one that I'm aware of. There's also a 14-year-old in terms of the youngest of people that were reported. I think that was in China. And also, I think a 10-month-old that had some medical concerns. So this is like, 3 out of 100,000 infections now over worldwide. So more than that, rather. I think the U.S. has hit 100,000. So 200, more than 200,000 infections total worldwide. So that's very low risk. And exactly, I'm seeing this person commenting. I did also hear about that infant from Illinois, but we don't know the circumstances. At least I haven't seen the reported circumstances around that. Yeah. So we're all looking constantly for evidence of vertical transmission and infection to the baby. I did read a paper today about the detection of antibodies in the baby, meaning that infected moms may pass antibodies to the baby, which actually would provide protection, but we not yet have confirmed with certainty vertical transmission. So we're all looking for it. always open to this being a possibility, but it hasn't yet been described with clarity. And that's the only thing I can really say about that.
Okay. Okay. This was a really informative one. They always are. So thank you again for doing it.
You're welcome.
I'm going to do my best for those of you who are wanting to watch this. I'll be live on the stories for the next 24 hours. I'll see if I can save this and we can use it as a reference point, because there are so many questions. And obviously, as we all know that the news and the evidence and everything keeps evolving. So thank you again.
You're so welcome. Can I make a final plug to everybody that please, if you have donations to give, or if you want to help in this scenario, please contact your local hospital or any hospital for donating towards more personal protective equipment for the staff. This is our biggest concern going forward in terms of protecting our healthcare workers, which, like I said, we're going to be in big trouble if we all start to become ill from this. And those are the majority of the circumstances for which we're having these meetings right now. And if you have any N95 masks that you want to donate either to a medical office, to a physician, or to a hospital, please do so. You do not need these out in public. You need only droplet masks.
Okay. Thank you again. And I think we're all thanking you. So much gratitude. And
I've received actually so many messages from everybody, and I do this because I care about all of you guys, and I want you to all be just as informed about what matters, because this is a new virus. We don't know what's happening, and we have to use our best judgment and adapt to the circumstances that we're learning constantly. So I want everyone out there to stay well. And we'll do it again. We'll do it again for as long as I can.
Thank you.
No problem.
I'll talk to you soon.
Bye from the Purple Stripes.
Bye.